Hello students, this is Dr. Nandhini from Vinayaka Mission Sankaracharya Dental College, working as Associate Professor in Department of Pediatric and Preventive Dentistry. Today I am going to talk about the topic rubber dam isolation. So rubber dam is also known as a dental dam, is a thin square sheet used to isolate the operative site from the rest of the mouth. Complete isolation of teeth from saliva, blood or gingival fluid exudates. Especially it is required when we are planning to go for any bonded restorations such as glass ionomers or composites. It helps in better bonding of the restorative material to the tooth surface. Thus it improves the enhancing efficiency of the restorative material. It also aids in isolation from bacteria in saliva. It's indicated when infection for the rest of the mouth must be excluded. For example, in direct and indirect pulp capping and endodontic treatment procedures. It protects the patient from swallowing or inhaling the instruments, protects the dentist from infection from the patient. So far, we have seen about the advantages of using a rubber dam. So, it also has its own disadvantages. We'll be seeing about it in this slide. The patient can no longer speak easily once the rubber dam is placed. Conversations thus become one-sided and cease. A few patients dislike the rubber dam intensely, feeling claustrophobic when it is in position. Rubber dam takes time to apply and remove, although the more experienced the dentist is in its use, the less time is taken for the procedure. So, when all the times that isolation is indicated, whenever the patient is having an increased salivary secretion, it might impair with the property of the restorative material. So, in such cases, it's better to use a rubber dam isolation procedure. When the patient is giving excessive tongue movements, it may again impinge with the property of the material, and so there is a use for a rubber dam. Increased danger of aspiration of the instruments. So, in such cases, it's also insisted to go for a rubber dam. Convenience of the operator. Thus, it increases the operating efficiency of the dentist. Improved properties of the restorative material. Isolation techniques help also in behavior management. So, what is the main objective of this? A dry, clean operating field. Access and visibility is improved. Improved properties of the restorative material. Protection of the patient and the operator. Thus, it prevents cross-infection, improved operating efficiency of the dentist. So, what are the other methods that we have in practice for isolation? We have two methods, one is direct and the other is indirect method. First, we will be seeing about the direct methods of isolation. In this, the top will be the rubber dam, cotton rolls, gauze piece, absorbent wafers, suction devices and gingival retraction cord. In indirect methods, it includes comfortable position of the patient, local anesthetic agents, usage of drugs like anti-sialogs, anti-anxiety drugs and muscle relaxants. So, this is a rubber dam and the armamentarium include the rubber dam sheet, the rubber dam frame, the rubber dam punch, rubber dam forceps, wax dental floss, scissors, rubber dam napkin, rubber dam template, lubricants and clamps. We will be seeing about each one of it individually. Apart from this, we even have the Wedgett's dental dam stabilizing cord. It paves way for easy and quick retention. It's used as an alternative to clamps. It's available in latex or even non-latex materials. Then the rubber dam frame, there are three types to choose the form. One is the plastic frame, that is radiolucent. It's even more flexible, but still it is autoclavable. The U-shaped plastic frame, that is radiolucent and autoclavable, that's insisted for a 5-inch or a 6 inches of rubber dam. And the U-shaped metal frame, which is autoclavable, that's again available in 5 or 6. The rubber clamp forceps, it's safely positioned clamps with our lightweight matte finished forceps. Then is the Aura Shield dental dam napkins. Applying napkins under the dental dam improves comfort and absorbs moisture. Dental dam stamp and template, it accurately marks the tooth positions. So, thus moving into the topic rubber dam isolation. This is a rubber dam sheet. It's available in different colors. it consists of two sides. One is the dull side and the other one is the shining surface. The dull surface is often placed facing the occlusal surface of the operator. So, since it is dull, it improves the operating efficiency of the operator and reduces the eye fatigueness. So, as we already explained, it comes in different colors like green, blue, black and brown. The black rubber dam is mainly used to improve the restorative work, offering good color contrast with the teeth. The green or blue provides an attractive background for color photography. It even improves the working efficiency and reduces the eye fatigue of the dentist. The shiny and dull surface is available, as I already told. It's going to be the dull surface facing the occlusal surface of the operator. It's available in thicker or thinner depending on the thickness of the rubber dam sheet. Sometimes the rubber dam is even scented with peppermint oil to improve the tolerance of the patient. In patients with increased gag reflex, this scented peppermint oil kind of rubber dams are used. This is a flexi dam. It's made of non-latex material. This is mainly insisted for patients who are allergic to latex material. So, since it is non-latex, it's easy to use and ensures optimum moisture control. It's even more flexible than the normal rubber dams that is commercially available. The highly elastic material contracts closely around the tooth for effective isolation. And this is a rubber dam frame. It comes in two forms. One is the metal and the plastic. Both are autoclavable. This is a handy dam. It has a built-in frame and a rod for insertion to keep the dam open, and this is available in one size. The advantage is you don't need a rubber dam frame, thus reducing the working time of the operator, and it is even easy to place. This is a dry dam. It does not even require any frame. This consists of a small sheet of rubber set into the center of an absorbent paper sheet with light elastics on either side to pass over the ears. This arrangement is most useful for quickly isolating the anterior teeth. Instadam, it is a foldable frameless rubber dam. No need to use any rubber dam frame. Simply punch a hole and place the dam over the tooth to be isolated. This is mainly used in case of anterior restoration techniques. So, this is a complete rubber dam isolation picture, and this is a rubber dam punch. This is a rubber dam template which consists of a hole size and position. So, with a rubber dam template, place the rubber dam sheet over the template and give a mark with a marker pen for the tooth that you are trying to isolate. This is a rubber dam forceps. The lubricants, it helps in easy placement of the rubber dam sheet into the teeth. So, the rubber dam napkins, it prevents direct contact between the rubber dam sheet and patient's cheek. It absorbs saliva that accumulate beneath the dam by capillary action. It's indicated in case of allergy of the rubber dam. So, the clamps, it consists of 4 prongs and 2 jaws connected by a bow. Retainers are also used to retract the gingival tissues. Many different sizes and shapes are available with specific retainers designed for certain teeth. So, these are the parts of a rubber dam clamp. It consists of a bow, a hole, jaw and a prong. The jaws of the retainer should not extend beyond the mesial and distal line angles of the tooth because they may interfere with the matrix and wedge placement. Gingival trauma is also more likely to occur because of this. The improperly directed clamp forces can traumatize the lip of the arch opposite to the one being restored. Fatigue of the bow of the clamp can also happen. The rubber dam frame can cause pressure marks on the face. Incorrectly punched holes and claustrophobic sensation may also be encountered. So, this is a different kinds of rubber dam clamps that are commercially available. There are mainly of 2 types. One is the wing clamp and the wingless clamp. So, this is a mint waxed one. Usually the rubber dam clamp is tied with a waxed dental floss. So, in case of accidental slippage of the rubber dam clamp, if it is tied with the floss, it's easy to retrieve by the operator. So, what are the contraindications? A child with upper respiratory tract infection, congestion of nasal passage or other nasal obstruction, presence of some fixed orthodontic appliances which makes it difficult for the operator to place it and take it out, a recently erupted tooth that does not retain a clamp, patients who have latex allergy. What are the disadvantages? It's mainly time consuming, patient objection, certain conditions may preclude the use of rubber dam like incompletely erupted teeth, third molar isolation, extremely malpositioned teeth, people suffering from asthma or mouth breathers. So just going into the topic of rubber dam placement, this is a step-by-step picture. Testing and lubricating the proximal contacts for better placement of the rubber dam. Then punching the holes. This is a rubber dam template. So the rubber dam sheath is placed over this template and the tooth which is needed to be isolated is given a mark with the help of marker pen, and with the help of the punching holes a punch is given on the same place that is needed to be isolated. So the smaller holes in the platform of the rubber dam punch are used for incisors, canines and premolars, whereas the larger holes are reserved for the molars. Lubricating the dam for better placement of the dam into the teeth. So selecting the proper retainer. Whenever you are selecting the retainer, see to that the retainer is properly engaging onto the tooth surface. If not, it might cause impinging of the gingiva. So as we already saw, there are two types of clamps. One is the winged and the wingless clamp, and there are different sizes available for different teeth. So make sure you select the proper size of the clamp for a better fit and prevent also the injury of the gingiva. So testing the retainer stability and retention. This is also done once the floss is placed. Then comes applying the rubber dam napkin. Once the rubber dam napkin is placed, you go for the procedure of placing the rubber dam sheath. See to that the napkin is properly positioned. Then positioning the rubber dam over the rubber dam clamp. Then attach the rubber dam sheath to the rubber dam frame to prevent slippage of the clamp that is placed. Passing the dam through the posterior contact, then applying the anterior anchor, passing the septa through the contacts, passing the septa through the contacts with the help of a tape. So this is how you do it for the anteriors, and see to that there is a proper fit of the rubber dam sheet in all the teeth. Then you can start using a saliva ejector to prevent flow of the saliva over the rubber dam sheet. So the saliva ejector is usually placed beneath the rubber dam. So confirming a properly applied rubber dam, this is how it looks once everything is done. Checking for access and visibility. This is how it looks once all process is completely and perfectly done. This is for a single tooth. This is a winged rubber dam clamp. Then comes inserting the wedges. The wedges are usually placed for proper tight contact and prevent even slippage of the rubber dam sheet. So far we have seen about inserting the rubber dam and the steps involved in it. Now we will be seeing about the removal of the rubber dam and the steps involved with the same. So first comes cutting the septa. For this you can use the scissors for cutting the septa. Next step is removing the retainers of the rubber dam. Then removing the rubber dam frame, followed by the rubber dam sheet and the rubber dam absorbent paper that is placed. Once this is all done, you can start wiping the lips because the lips will be literally dry since it is a completely dry field. Then ask the patient to rinse the mouth and massage the gingival tissues. Since there is too much of pressure into the gingival tissues while placement of the clamp, it is insisted to go for massaging the tissues to prevent the gingival trauma. So then examining the dam. What are the other alternative methods that we can imply in placing the rubber dam? First you can apply the rubber dam clamp, that is the retainer, and then the rubber dam, or place the rubber dam sheet first and over which the rubber dam retainer can be or the clamp can be placed. There are some errors that we come across while placing the rubber dam. Those are as follows: incorrect arch form of holes, inappropriate retainer, retainer pinched tissue, shredded or a torn rubber dam, incorrect location of hole for a class 5 cavity lesion, sharp tips of the retainer, incorrect technique for cutting septa. So what are the other recent ones that is used in the rubber dam? Because the rubber dam main disadvantage is it's time consuming. So there are recent ones which have come across to reduce the time while doing the procedure. This is a hard dam which doesn't need any rubber dam frame or the procedures that we saw before. It's just, this hard dam is just a single piece of material which doesn't require any rubber dam frame. The holes are just punched and placed over it. So it's very less time consuming. The recent advances with the clamps, it consists of a cushioned metal clamp jaw. It prevents injury to the gingiva. So this is a rubber dam clamp with a carbon fiber. Before we were using metal rubber dam clamps, those might cause injury to the gingiva. So to prevent that, these carbon fibers are even more flexible and it causes less trauma to the gingival tissues. This is called a cool dam, where it comes with the form of a syringe. It applies over the gingival region and it reduces loss of time of the operator, thereby also prevents seepage of the gingival clavicular fluid while doing the restorative procedures. So the other isolation techniques and methods used for the materials include cotton rolls, gauze or the throat shields and absorbent papers. These are even used as alternatives for rubber dam. Next comes the saliva ejector. This is usually placed below the rubber dam to prevent the pool of saliva that is coming with the place of the rubber dam. After placing the rubber dam, beneath the rubber dam is pooled with the saliva. So to prevent the pooling of saliva, the saliva ejector is used to take out the excess of saliva. It comes in different forms and types. One is, these are the metal ones. The metal ones are usually autoclavable, and the other one is a plastic one. It even comes with a tongue retractor. So it paves way for better isolation. So these are also called as a disposable saliva ejectors. It comes in different colors and it is not reusable. It's just used for one patient. So hereby I conclude telling that the judicious use of isolation method ensures greater patient comfort and delivery of high quality dental care to pediatric patients. Thank you all for the wonderful opportunity.